All right, so are you going through some withdrawals to alcohol? So, alcohol affects a chemical called GABA. It's like the relaxation chemical in your brain. So, when you take a shot, theoretically, alcohol it is a depressant, but in the first couple shots, it does have like an anti-anxiety effect, just like you were to take a benzodiazepine like Klonopin. So theoretically, they kind of have this very similar nature, right? So let's say you've been using alcohol for a long time and you have chronic alcohol use, right? The way that the brain works is that it assumes if you put something outside of your body, that your body naturally produces less of its own GABA, right? So if you give GABA-ish substances, it's going to produce less of its own GABA. And so when you stop alcohol use, right, because after a while it becomes a very chronic problem where you have tolerance, withdrawal, there's a lot of criteria, which I'll talk about in another segment. But you start to notice you need to drink more and more. And then when you stop, you notice that your body's starting to react. And why it does is that GABA, as it goes down, there's a chemical called glutamate, which is excitatory. So it produces the exact opposite reaction, but it can be life-threatening. So Valium, which has been used for many, many years, in residence, we had to remember I would Valium load a patient. So I would have a criteria and a checklist called the CWA. Basically, it stands for a checklist for alcohol withdrawal. So a lot of factors to look for. And then you give them a lot of Valium, and Valium is long-acting. So it's used, it's oral, you can inject it. So pretty much it's used for alcohol use, agitation, tremors, catatonia. So it causes sedation, fatigue, depression. It's a good medicine. It just stays in your system for a long time. Now, the one problem is if Valium, someone takes it and overdoses on, it can cause respiratory depression.